better future. What is that? What would you like to see in a better future, and how do we achieve that better future?
We are delighted to introduce to you our UNFPA representative, Miranda Tabifor, to give us these insights. So Miranda, please come through, and thank you.
Better Future Summit. And what just came to my mind is that it's as if all mutual people were actually prophesying, if you know, that it's just 1 month ago that the world congregated in the United Nations in New York on what we call the Summit of the Future. So as I was reflecting while I sat there, I said it's all mutual, all reflected in terms of implementing even the parts of the future that was the outcome document that brought more than 190 member states of the United Nations globally. So 1 month ago, member states met in New York on this Summit of the Future, and they adopted the part of the future. And it is exactly 9 years ago, if you can remember, that the Sustainable Development Goals were agreed upon by the same member states. And then coming back to UNFPA, 30 years ago, governments of more than 179 countries met in Cairo, and they put together what we call the International Conference on Population and Development Program of Action. Program of Action. This program of action, if I know we are connected, if you Google the program of action of this international conference, is generally called ICPD agenda. It is an encompassing program of action. It is not very selective to what UNFPA does, but it's a blueprint document that even guides what we are discussing in this Better Future Summit. That having said, I have actually decided to focus my contribution to this summit on delivering sexual and reproductive health here in Zimbabwe in the context of this summit. So I'll start with some statistics, because UNFPA also is a data agency. The statistics in terms of saying that what is happening in the country, but let me say briefly what United Nations Population does. We are globally known as the Sexual and Reproductive Health Agency. I would like us to be taking note of some of the words that I'm going to be pronouncing. And then we work to ensure that every pregnancy, it is a world where every pregnancy is wanted. I'm bringing the angle of the hell. Every pregnancy is wanted. Every childbirth is safe, and every young person's potential is fulfilled. So there are 3 angles. So on the basis of that, it means that the work that we do focuses on the maternal health, the health of our mothers. Maternal health, it focuses on the prevention of gender-based violence. It also focuses on young people's development. Those are the 3 broad areas of work that we handle. And then the aspect of data cuts across what we do, because without data, you cannot plan for the population. And we know that Zimbabwe held the last population census in 2022, where at that time, the population was 15 million, and is now projected to be more than 15 million. So on the basis of that, we address maternal health issues. We look at adolescent sexual and reproductive health issues. We look at gender-based violence as affects women, with the overall goal to contribute to universal health coverage. That is overall goal. So that is what we do as UNFPA. So coming now back here to Zimbabwe, what we do in terms of the SDGs, which we are looking at, because that's a global framework that governs our work, which has been carefully and properly enshrined into our National Development Strategic Framework document, which I believe I saw the program, somebody has already spoken on the NDS1. So I'm not going to teach us about the SDG, but looking at the SDG number 3, there were 17 Sustainable Development Goals. And SDG number 3, that focus on good health, really looks at what we are supposed to be looking at in terms of maternal health, unmet need for family planning, and gender-based violence. So the statistics I want to present to us under maternal health for Zimbabwe. Here in Zimbabwe, it is very interesting for us to know that our mothers, I want to categorize, when it's about maternal health, that is somebody who has reached the reproductive age to give birth. 6 of this category of the population in our country die every day. 6 of our mothers, those who have reached the reproductive health age, die every day. That is the statistics. Because without statistics, we cannot plan for the population. Okay? So, and on the basis of that, of those 6 of our mothers die every day, there is a trend with regards to maternal mortality ratio in the country, which I would just want to summarize every 10 years. In 2002, 1,069 women or mothers of this reproductive age were dying every time after giving birth. If they put 100 women who are giving birth, 1,069 were dying in 2002. I want to give the good news, the picture, and then making us to really be motivated to work towards reducing it. In 2012, after about 22, in 2012, the government and its partners worked together to ensure that maternal mortality ratio dropped from 1,069 to 525. So it means that when 100,000 women give birth, so 525 die. It's still not good, but it was reduced from 1,000, almost half. And then now in 2022, we're in 2024, 362 women of reproductive age are still dying, giving birth from 100,000 live better give birth. So why I'm giving these statistics is that we're talking about SDG number 3, good health, well-being. And Zimbabwe committed to the SDGs by saying that by 2030, they want to really reduce this maternal death by 80 points. So it means that at least we should not have 362 mothers or women of reproductive age dying, but 80. So that is a big target. And we have covered 9 years to the SDGs. We are left with a very short time. That is the challenge that we have, which we need to work collectively together. So on the basis of that data on maternal mortality ratio in the country, we want to congratulate the government of Zimbabwe. They are not skipping. They are working with ourselves, working with other partners, including ourselves. And we know what has been happening with regards to the different frameworks that we have in the country. We have the National Health Strategy. The government recently signed the National Health Workforce Strategy and the compact to ensure that we have the investment that we need to ensure that the country addresses the health challenges of the country. I want to come now to the youth agenda. You spoke about the young people. They represent a percentage of the population that is even not employed. And this is a critical percentage. I think 67% of the population, according to 2022 population census, are young people. And this very summit of the future that I talk about came out with what they call the compact for young people. A generation of these young people have a summit declaration that has come out. So for Zimbabwe, what we are trying to say is that we need to engage the young people. I don't know what other young people in this our summit. Summit? Better future summit. I don't know whether the young people here, if they represent this percentage of the population we are talking about, we are planning for, I don't know why we don't have them in the house. But one of the critical agencies that really works for or supports the government to work on is the young people. And we have so many initiatives. I want to give also a bit of data because as a data agency, we like to speak with data. You cannot just plan in assumption. You have to get the data to put the money where it matters. So the situation is what? What do we have in terms of the situation of young people in the country? We have child marriages in this country. It means that we may be here, we are uncles, we are fathers, we are mothers, we are aunties, and we have child marriages in the country. 33% of our daughters, 33% of our daughters who are aged between 20 to 24 are married. They are in a union before they are 18 years. Because we know that 18 years is the age reckoned by the government by law. I said that we can be involved in getting married. That is what is prescribed that 33% below that age, they are already in marriage and they are giving birth. So it means children giving birth, children being pregnant, and we can know the economic impact of that kind of situation. That's the situation in the country. And then we have high teenage pregnancy. High teenage pregnancy, which is alarming, is so painful that instead of our daughters, our sisters being in school, they are pregnant and they are at home. And what we did during the COVID, it was very touching during the COVID period, that a study was even undertaken. We all know the impact is still there, because we see how that percentage of teenage pregnancy in the country. More than over 300,000 of our daughters were pregnant during the COVID period. They were not in class. They were not in school. Teenage pregnancy is rising. 42%. How do we get the data? Data was collected at the health facilities. 42% of the health facilities that were contacted or that were visited recorded antenatal care for our daughters who are supposed to be in school but they are pregnant. So how do we plan for those our daughters? That is one of the issues I want to bring on board. And then we also recorded that the maternal deaths that were recorded at that time, even now, 25% to 30% of the maternal deaths came from that age bracket of our young women or young girls or our daughters who are pregnant. So that is very, very critical. And then the last aspect of the situation I want to bring, though Zimbabwe has been applauded for reducing, making significant investments to reduce HIV in the country, but we still have HIV in the country where we have significant sexually transmitted infections. We know our young people are involved in drug and substance abuse, and we're very happy that the partners, including the United Nations and ourselves, we are supporting the government to implement a national strategy and framework to address drug and substance abuse in the country. That framework document was launched by His Excellency, the President of the country. So we're talking about young people. As we're having this summit, they are not yet back. These are the issues affecting our young people, the future generation that we are working to ensure in terms of leadership. So what has been the response? The response to all of this, targeting young people, we have to ensure that we involve the young people in everything that we do in decision making. We have to build their capacity. We have to ensure that they have access to the information they need concerning their reproductive health and rights. And then in terms of the gaps of the drug abuse, I think we just need to implement the policies. The previous session talked about policies, the environment that is conducive. So let's implement the policies that we have instead of reinventing the wheel. So the next element I want to talk about that brings about the health also of our mothers or in this country is in the area of gender-based violence. I want to believe that one of our colleagues must have spoken about gender-based violence in the country, which is linked because our programming is integrated. It is not done in silos. So gender-based violence is another issue that is facing the country. And what we have been doing in terms of gender-based violence, if I give us the information, is that the survivors of this country are representing 39% of the women and the girls in our country have been abused in one way or the other. I don't want to give a lecture about the different types of violence that we face in this country, but our mothers. Because gender-based violence is what? Is it economic violence? Is it physical violence? Is it sexual violence? The 39% of the women and girls between the age of 15 and 49 in our beautiful country, Zimbabwe, has experienced physical violence. I will have the data. Since 2015, it's not acceptable. It's not acceptable. We cannot plan for the future when we have this. We cannot plan for the future when we have this type of challenges. It cannot be possible. So the summary is that 1 in 3 women and girls, and we said that we don't want to give that kind of statistics. So you walk in the streets of Harare, 1 in 3 women or girl has experienced one form of gender-based violence, whether it's intimate partner kind of violence, and we don't want, that's not the kind of population or want in the country. So we have been working to provide gender-based violence prevention and response through different mechanisms, through advocacy, through establishing one-stop centers at shelters, working with the line ministries like the Ministry of Gender, because it's an integrated approach with Ministry of Health. So the last aspect I want to bring on the table with regards to this health, good health and well-being, is on data. Very important data. If we did not have a session on data, it would have been remiss on our part. And I want to really applaud the government because ZimStat is here. ZIMSAT provides us the statistics and data that we need, and we have been working at that level for data policy and programming. And recently, through the work that ZIMSAT is doing, we're going to be publishing other data to help us plan better. But in terms of what we have been doing, we have different surveys that were put together. The census of 2022 has over 12 thematic reports looking at topical issues. I've talked about the youth. The young people's thematic report is going to come out, which we are going to look in terms of what we want to plan for the young people. We have the demographic health survey, and I believe anytime soon we are going to convene and publish what that survey is revealing in terms of the health of the population. So, ladies and gentlemen, I know that it's almost time for lunch, but I would like to conclude. I want to bring it back to what we're talking about is the SDGs. Zimbabwe has been applauded for the role that it's playing to implement its commitment and obligation to implement the SDGs. And in July this year, Zimbabwe presented to the high-level political forum the status of the implementation of the SDGs ever since the SDGs came into force in 2015. So it's something that we have to applaud. And there has been, they call those reports voluntary national reports. And I want to believe that all mutual and all the partners who are here will have access to that report. Because on the basis of that report, we'll see how is Zimbabwe doing. We are just 6 years to the end of the SDGs. Are we on track? Which actually, when they're preparing the reports, very good initiatives have been on board, but globally, the SDGs are not on track. But even though they're not on track, as a member state that committed to the SDGs, I think we have to support Zimbabwe to ensure that it actually meets its obligation. So, in terms of that, I have three recommendations I want to make when it comes to this segment of the health, the well-being of the population. One, we're talking about partnerships. A partnership that has brought us here today for this summit. So, and we're very, very happy that the private sector is here. The private sector is here, and the private sector has a key role to play to advance the SDG and the agenda. Number two, financing. We cannot plan and deliver for the health of the population. We cannot plan and deliver for the well-being of the population when we don't have resources. And what we're talking about resources here, in line with what is happening at the global level and regional level, we are talking about domestic resources. And the question I want to ask the private sector that is here and other partners, how is the private sector involved and engaged in ensuring that the health of the population is on track, in line with the vision that the country has to achieve the upper middle income status? How is the private sector coming on board in all those sectors? We've talked about labor or markets, we've talked about employment, but how is the private sector coming on board in terms of that? So we are advocating for domestic resources where we believe that the private sector has a key role to play. So as UNFPA, that is in the bigger United Nations family, and my sister has spoken, and I think others had spoken before I came, we are committed to supporting the government in ensuring that the vision that the government has to achieve the upper middle income status, in line with the SDG goal number 3, of well-being and health, we are committed to doing that. And the document that actually binds us with the government is what we call the United Nations Development Cooperation Framework, that has just undergone an extensive review. It is into the third year of implementation, and we have different thematic issues where we are talking about the 6th transition for Zimbabwe to succeed. I mean, the pathway that Zimbabwe can actually contribute towards achieving its SDG goals is to really embrace the pathways of addressing the mega trends of climate change, the biodiversity, we have talked about employment, social protection, the health and the well-being, and the rest. So I want to really end by once again appreciating the organizers of this Better Future Summit, and we commit to be open to ensure that the recommendations coming out from this summit is actually implemented. We don't just leave it in documents. We should implement them. Thank you so much for your attention.